Welcome to the Mississippi State University College of Business Family Business Education Initiative responding to COVID-19. Today's session is on business insurance and COVID-19 considerations. We have Brandt Galloway here. He is an insurance guru, and you can walk us through the process. So sort of give us an idea of what we're going to talk about today.
Sure. We'll talk about a few things today. A number of questions that we get a lot is related to business interruption coverage. And that's certainly been the primary one, but there are other considerations, workers' comp, other consideration coverages in terms of has your business model changed? Are there new coverages that you need to be aware of? Are there changes in payroll, sales figures, and sort of the impact on your coverage in your business at that point?
So when you talk about business interruption, it's sort of a broad term, right? So how do you narrow that down? How do you classify what exactly is, what isn't? Put it this way, what are your clients asking you?
Sure. Well, they're asking, a lot of them were shut down for a short period of time, middle of March, early April. Some of them, unfortunately, having to go back into shutdown mode or significantly decrease their operations. Certainly the hospitality industry has been hit pretty hard in terms of limited capacity and things of that nature. So a lot of them are calling and saying, hey, listen, our business is not what it was prior to COVID-19, and we have business income coverage, business interruption coverage. How does our policy respond to us not being able to operate as we were prior to this event?
So how could the insurance company have anticipated something like COVID-19 when, it's sort of, I think the severity of it sort of caught us all by surprise.
Yeah, certainly. And unfortunately, most policies do not respond to COVID-19. There are a few that were foreign written policies, most of them event cancellation policies, which are a little broader in terms of scope and the things that they cover. I know you're a tennis player, Jeffrey. Wimbledon, for instance, was one that had some loss of income coverage. They were concerned back when you remember SARS, 2002, 2003, in that time period. And so they purchased a very non-standard type policy, and I think they paid about $2 million a year.
I was going to say that Wimbledon has that luxury, the mom and pop, they want to make sure they're covered, but you don't want to buy coverage you don't think you need. And I guess you, as an agent, you sort of have to guide that process, right? You want to make sure they're covered, but you don't want to give them too much coverage.
That's right. A lot of small business policies have business interruption coverage built in. Some larger ones, manufacturing policies and things, you have to add that separately. But some are built in. But unfortunately, within most of the domestic policies, there is a caveat that it is a property coverage, Jeffrey. So it's written into the property policy that the loss of income must come due to a covered cause of loss, due to direct loss at the location described on the policy. So unfortunately, COVID-19 is not a covered peril under a property policy. Loss of income, business income coverage tends to be triggered by wind, fire, vandalism, sprinkler damage, things of that nature. Unfortunately, COVID-19 was not written into those policies. So there have been a couple of instances where we've seen, particularly in the hospitality industry, where there was policies designed specifically for food poisoning, where maybe it was not defined appropriately, and there's potentially some coverage for loss of income if that endorsement were on the policy. But
well, at the end of the day, I guess the best advice is to check with your agent and read the policy.
Certainly, and we had a number of customers that would call in as this originally came out, and were afraid that if their businesses were shut down or suspended for a period of time, they may have to ask for, this was prior to PPP, right? Mm-hmm. So ask for loan help, rent assistance. And so a lot of our customers called in and said, listen, I understand I don't have the coverage, but I'd like to file a claim so I have proof that I've done my due diligence and tried to collect where I could.
What about the area of workman's compensation?
Yep, that's a good area, a good question. There's not a lot of guidance thus far on workers' comp claims. There's still a lot of uncertainty that's surrounded with COVID-19. Clearly, we have healthcare workers, first responders, and things that are dealing with a lot of patients and a lot of testing for people that have COVID-19. And clearly, it's a very communicable disease, if you will. So there's a lot of uncertainty as to how workers' comp will respond. Historically, communicable diseases have not been picked up by workers' comp. Workers' comp kind of came out of the Industrial Revolution, Jeffrey, so there was a lot of mistreatment of workers in those facilities, and so workers' comp was originally put into place. It was construed very heavily in favor of the employee. So even if it's negligence on the part of the employee, if an employee is injured on the job, the sole remedy is workers' comp. However, the communicable diseases have not been. I mean, as you can imagine, in your career, you've probably been around plenty of people at the office who had a cold or the flu, and it was passed around, via office. And it's difficult to prove whether you got it at the office or you got it at home or the grocery store or wherever. So COVID-19 has been perceived thus far in the workers' comp community as being a communicable disease, and we don't know whether we transmit it at the office or at a facility, or if we get it at the grocery store or the gas station. So it has been difficult to determine whether you got it at work or not. However, there's probably some likelihood that first line responders and healthcare workers could contract the virus by virtue of their employment. There are a number of states, there are about 10 now, that have put into place some laws that sort of flip the burden of proof back to the employer. So if you are, and it's all for frontline workers, healthcare workers, these states have enacted it for. So if those workers do contract the virus, that is a compensable workers' comp claim in those states for that particular segment of employees, and the employer then has to prove that they did not contract the virus as a means of their employment. So that is not in Mississippi at this point. I have not seen any legislation proposed in Mississippi that would do that, but it is a consideration, and it's certainly possible that we may see that in the future.
So what other considerations do you see down the road as far as insurance goes when this is all over with and folks sit back and analyze, okay, this is what happened, we're in the insurance space, what adjustments need to be made? Do you see anything changing?
Potentially. There are a few bills in front of Congress now. There's one in the House, and I'm talking about the U.S. Congress, not the state, but there's one in the House and there's one in the Senate. There's a couple of bills out there from different industry groups. If you'll recall, I mean, in some form or fashion, this is similar to 9/11. It was really not an expected pandemic. Certainly there's a possibility that it exists, but nobody expected it to happen. The insurance industry has not priced for it, did not contemplate the cost, the ramifications of an outbreak like we've seen. So certainly there's a possibility that there may be a federal program for another pandemic, probably not COVID-19, but the next pandemic. If you'll remember, when we had the 9/11 attacks, there was no real terrorism insurance in place at the time. There is terrorism coverage in place now. I don't have many people that know customers that purchase it locally. As you can imagine, terrorism is kind of we see it as being in a metropolitan area. That's where the most risk is. COVID-19 is sort of like a dog with a trespassing sign. It just doesn't, right. COVID-19 knows no boundaries, right? So it's more difficult to price. It's more widespread. It's worldwide.
Hasn't there been some talk as well on the federal level and state level of legislation that would protect businesses from being sued because of viruses like this? And what impact does that have on insurance?
Sure. Well, I think that would have a positive impact on insurance rates. Clearly, as an employer, I think people are worried about being held liable for employees contracting the virus and spraying it potentially at work, spraying it to customers. So I think most employers would be in favor of some legislation that would give protection to the businesses, particularly those who are trying to do the right thing. I mean, clearly we're encouraging appropriate use of protective equipment, social distancing, the use of Zoom and use of email and phone calls when appropriate, and avoiding large crowds and things like that. We have a number of customers who are manufacturing. They have to be on site, but they're trying to do the right thing and use the appropriate distancing, perhaps using more shifts, fewer workers on each shift. So,
well, yeah, that leads to the next question. Should you contact your agent if all of a sudden you have more folks working at home, you're not using your facilities as much? Does that impact premiums or coverage or anything like that? Or what should a business do if they've seen some relatively drastic change with what their workforce or work environment looks like?
Yeah, certainly it could. I mean, a lot of your insurance premiums are based on the type exposures that you have, whether that's workers' comp or your liability or even your property coverage, right? It's a function of your operations. And so if your operations are changing, you certainly should contact your agent and determine what changes in exposure may have occurred and whether that would positively or negatively impact your premium. I'll give you a for instance, Jeffrey. If you're in the sales business, you may have a lot of guys out, out and about, right? Traveling, burning up the roads in a vehicle. A lot more exposure than somebody who's just sitting behind a desk. Mm-hmm. So, we're in the sales business too, and we're out of the office a lot, but COVID-19 has kind of confined us a little bit. So in that situation, we're more of a clerical employee now than we ever were before. So if from a workers' comp perspective, the rate is a lot less for a clerical employee than it is for somebody out driving around. You can understand that the exposure to a physical claim is much less if you're just sitting behind a desk.
Or working from home.
Or working
that's got to have
home.
some kind of impact as well.
Yeah, that's correct. And some other things we may need to think about are what type of equipment are your employees taking from your office to their house? Are they taking laptops and expensive monitors and things like that, and taking it out of your office, the facility, and moving it to their house? Do we have appropriate coverage for that type of equipment away from the premises? Those are things that need to be considered. Are class codes changing? Do you have somebody who perhaps was performing a certain function and maybe now you're subbing some of that out and that person's doing a different role, maybe more or less hazardous, right? Mm-hmm. So you want to contact your agent about those things, because what will happen, Jeffrey, at the end of a policy, if I've gone from doing something that was deemed to be pretty hazardous and now a clerical role on an audit, that'll shake itself out, but you may be overpaying or underpaying, and when it comes time for audit, you may be in for an unfortunate surprise if that happens. Another consideration would be if you have employees that are furloughed and you're still paying them. I know that with PPP, some of those employees are being paid, but their jobs are not as active as they were before. Maybe they're working 2 or 3 days a week instead of 5. So with respects to workers' comp, it's payroll based, and if somebody is furloughed or staying home more often, yet they're being paid a similar wage, some of those can be rectified on a workers' comp audit. So I may be getting paid a certain wage, but I may not be working as much. My exposure to a workers' comp claim is theoretically less, right, even though I'm being paid the same or similar wage. So those need to be discussed with an agent. We have a number of say restaurants, for instance, that we insure, and they had a lot of people coming in, dining in, and now they're delivering. Mm-hmm. That's an exposure you need. Are you doing delivery that you were not doing before? And what kind of exposure do you have when you've got employees that were never driving before that may now be driving? Do they have appropriate training? Do you have the hired and non-owned type exposure coverage built into your policy that maybe you didn't have before? So all of these things are things that you need to be discussing with your agent. Clearly, as things change, policies can change as well, and we certainly want to make sure that we're trying to be proactive, right, with our policy and with our coverage. The worst time to ask if you have coverage for something is after you have an accident, right? So
right. So you really right now, actually more than ever, I would think that your insurance agents need to be consulted. Like, so you don't want to wait till after the fact. This is really the time to get with your agent and and see exactly where you stand.
Sure. And as business models change, insurance plans and coverages may change as well. As I mentioned, you may go from performing a certain function or making a certain product to maybe now subbing that out or having a supplier provide a certain piece of equipment that maybe you were perhaps making before. That changes the scope of your exposure.
You could actually save a little money, maybe.
Could potentially save some money, that's correct. And we also have a number of customers who do work for certain facilities that require them to carry certain limits. They may prefer to carry, and I'm just going to make this up, $1 million or $2 million limit. Maybe they have a customer who's requiring them to carry 5. If they're no longer doing work for that customer and times are tight, maybe you don't have to carry a $5 million limit anymore. Maybe you want to look at bringing that back to 1 or 2. So those are considerations to be made. And each policyholder will be different in terms of their change.
What? Anything else you want to add?
No, Jeffrey. I mean, I think it's important just to discuss these issues with your agent. Make sure that everybody's on board in terms of what we have, what exposures we have, and understanding where your business is going, and that changes. It can change dramatically from one week to the other, right? This COVID-19 crisis has been tough on a lot of people, and so I'm empathetic to employers and the situations that they're going through with employees, and clearly local job providers here in Mississippi. I mean, they want to send their employees home safely. They want to be successful in their business. It's difficult from an employer's perspective to go from having people in the office every day or in your facility to sending people home. I mean, that's changed the business model for a lot of people. I think we are a more technologically advanced society now than we were 10 or 15 years ago, and perhaps COVID-19 has moved us further down the road, maybe a little faster than some of us were ready.
It may also have made us realize that despite all the technology, we still need the human touch, right? We still need the human interaction. It can't all be done. I know my wife is working from home, and she thought it was great, and now she's been in her pajamas for 8 weeks, and she's ready to get out and get back and join the world. So
well, we appreciate that too, and that's. It's a fun part of the insurance industry. It's a very people-oriented business, and so it's always fun to be around people. It's been difficult for us not to be in front of customers, not to be able to have the same interaction that we're accustomed to. Clearly, we're very blessed that we have things like Zoom and email and Skype and FaceTime and things like that to stay in touch with people, but it is difficult on a lot of people, and so we have to keep that in mind. And again, from an insurance point of view, just try to stay on top of the risk and the exposures that our customers have as things change for them. So certainly want to continue to stay in touch with everyone as they have questions, whether it be loss of income, or how do we handle workers' comp, or how do we handle health insurance, what types of legislation are out there that we need to be considering supporting, be it, like you mentioned, the protection for businesses from a liability standpoint, or do we need to be supporting some type of federal program for the next pandemic, the next business interruption type claim. And some of that is out there. I think it's like I mentioned in 9/11, they had a federal backstop for the terrorism coverage. Some of the bills proposed at Congress now are very similar in that regard. The insurance industry is really good at adjusting those type of claims, but they are not prepared. They were not prepared to pay them at this point. They're not in the policy period, in the policy language now. Maybe at some point in the future, but if so, there's I think it'll be a mixture of private and public coming together to cover the next pandemic in terms of loss of income. The insurance industry will likely adjust them. Perhaps the federal government will be the ultimate payer of the claims, but. That's yet to be seen, but I hope something comes about, because our customers need that, and I think this is something we're going to live with for some period of time. And
I think you're right. Yeah. Well, we want to thank you. Put your contact information up on the screen. This is Brandt Galloway, managing member of Galloway Chandler McKinney Insurance in Columbus, and you can get in touch with him with more questions. We appreciate the insights and the information very much.
Sure. Thanks for having me.
And we hope you have found it helpful as well.